Hi, this is Dr. Tom Rogers coming to you with a weekly podcast. I call it the Common Sense MD. Common sense is uncommon these days, so that's why I have another person with common sense for the second time, our Congresswoman Diana Harshbarger.
Yes.
Welcome. Thank you for coming back. We had a great first session. We talked a lot about politics and the government and healthcare and all that. I think we got a lot of that off our chest a little bit. You know, we both get angry about and frustrated with practicing medicine in these days. But anyway, so today, you know, I talked last time about how you and Bob brought me into the world of functional medicine, and that really started with bioidentical hormones. And as a compounder, I mean, you guys are well known throughout the country as doing compounding for, meaning making a medicine that otherwise you can't get through a branded medicine. And you can explain a little bit about the rules on that, but it's become a little bit controversial. So you all got me into this, and we did fellowships together, and we're probably as knowledgeable as anybody in this area about a lot of this stuff on compounding and hormone therapy. There's a lot of misconceptions about it, unfortunately. And when the Women's Health Initiative came out, 16 years ago, it really did a whole generation of women a disservice by denying them hormones. And if you look at the study, you can go to another one of my podcasts and find out why that was such a bogus study that they thought, well, I can't take hormones because of breast cancer. Well, if you look at the study, bioidentical hormones do not cause breast cancer or heart disease. They prevent it. So, but take a deep dive on that, and we'll talk about medroxyprogesterone at some time on another podcast. But take my word for it, these bioidentical hormones do not cause breast cancer or heart disease. But in any event, it's great to have you on the show again today. And let's talk about compounding, because right now I'm having a hard time getting some of the compounded medicines I want because the FDA does not like compounded medicines or compounders because they can't. Well, I think they're kind of bought out, aren't they? Tell me your theory. What is a compounding pharmacy, and why are we having so much problem with it now?
Well, compounding pharmacies, we go to 4 years of pharmacy school. Of course, we have a regular pharmacy, but we have additional training. You know, most people can compound, but they, put two ointments together, things like that. We have been PCAB accredited by a PCAB board. You know, we've gone through extensive training, sterile and non-sterile. And sterile means IV products. Non-sterile means we compound anything and formulate things that would benefit the patient. And, it could be capsules, it could be topicals. Our specialty, honestly, when you first met us, was really Bob and some of the creations he'd done with delivery systems, transdermal. You put it on the skin, it goes in just like an injection, but, you don't have to have the needle. There's so many things. Lyophilized drugs, we were the first pharmacy in the country to ever take a liquid form of a drug and dehydrate it, basically is what you're doing, to a powder form. And so when you see that and the things that we can do, and the main thing we do, honestly, we can formulate anything. If you give us a problem, and Tom, when we first met you and some of the other physicians in the area, we would go in and say, look, we don't need all your patients. We need the ones you have problems with or you can't find a solution. And that's the ones they would send us, the most difficult ones, especially the hormone. The docs didn't want to hold their hand. But boy, we set out to change the whole world when it came to doing natural or bioidentical hormones. But we would only tell them, send us your problem patients. We'll take care of them. And that started us on a journey that led to being 797 compliant in 797, 795, 797 USP 800. Those are big numbers, and I know that most of your listeners don't understand, but these are all the certifications and all the processes we've gone to be the best of the best, and to teach other compounders around the country how to do things to take care of their patient populations. And I'll tell you where it really came in handy is during, and it still does for compounders all around the country, is we step in when there's drug shortages. Man, that's a whole topic right there that I can go
Yep.
into. That will also, we can go into what the government's doing or not doing to alleviate
It's
that.
amazing how these drug shortages have come about. It was interesting because I was watching one of the Republican debates, and Nikki Haley goes, talking about these drug shortages. She goes, we have a factory in Bristol, Tennessee that could churn out amoxicillin by the hundreds of thousands per day, and yet we're getting it from China. So there's this drug shortage of amoxil, the oldest antibiotic that we use probably. But why do we have a shortage? And agreed, the compounders have stepped in and saved the day. I don't care whether it's Joe Blow at somebody's office in Kingsport, Tennessee, or whether it's John Hobson's clinic. Everybody uses compounded pharmacies.
Yeah. Well, when you first met us, we were compounding for patient needs here in the Tri-Cities. And then what happens is doctors go to conferences, and these healthcare dentists or whomever, they go to conferences around the country, and they tell people, well, I can get that. I know it's short, but I get it, and this is where I get it from. We ended up doing things for Johns Hopkins, UCLA Medical Center, Mayo Clinic. I mean, you name it, they would call us because they knew we could meet a need that they couldn't get a drug for. What happens is there's drug shortages, and, for 25 years I've gone to Washington, D.C., and I've lobbied my congressmen and my senators about one thing, and that is drug shortages. And when you hear the three letters API, that's active pharmaceutical ingredients, I tried to explain, look, this is a problem. We're compounders. We know where this comes from. 90% of our active pharmaceutical ingredients or finished product comes from China. Now, I don't know if you've noticed lately, but China is an adversarial nation. They do not have our best interest at heart. And when 90% of your pharmaceutical industry and the things used to make it comes from China, you've got a huge problem. I keep telling my colleagues in Congress, you don't have to drop a bomb. China doesn't have to drop a bomb. They just have to say, we're going to cut your medicine off. And I will tell you this, and this may open up a little later, we know there's a threat that China will invade Taiwan. And who's to say if we step in to try to help Taiwan that they won't say, okay, you don't get your APIs, you don't get your medicine. I'm not saying that's going to happen, but I wake up in the middle of the night thinking about things like that because that's how critical this is. And it didn't happen overnight. It happened over the last 25, 30 years. We've outsourced everything we do because of this right here, the money.
Yep.
And incentivize our companies to start producing right here in this country like U.S. antibiotics.
Yeah, it's unbelievable that they are not.
That they don't
doing
even
that.
have a government contract to produce amoxicillin, which was in short supply. You couldn't even get it for your children last winter. And we have a company right here that can make 330 million doses for every American because how do they treat anthrax?
Amoxil.
Penicillin. So I don't know. Maybe I try to bring common sense back into the equation and say, look, incentivize your companies to stay in business right here. And if we can't produce it, guess what? Go to an allied country and set up shop, which is one thing I'm trying to do with Israel right now, is we're trying to get a technical assistance FDA set up so these innovative ideas and these products coming out of Israel, the whole, Abraham Accords nations, all those people, all those countries that want to get into the chemical market and the pharmaceutical market, they have FDA is the gold standard for the world. And you have a technical assistance facility right there that can tell them how to get their product on our shelves so we won't be reliant on China. That's just common sense. And we're working right now with Israel and their Ministry of Health and their Prime Minister to get that done.
They're really innovative, aren't they, in Israel?
Look at the Nobel Prize winners that they've had out of that one tiny little country the size of Rhode Island.
Yeah.
They are brilliant, and they're way ahead of a lot of different countries around the world in their technology.
So the compounding pharmacists really step in when there's a need, but there's a daily need in my practice for compounding pharmacies. For example, the bioidentical hormone therapies, or really anything. I remember, I would yell across the hall. We worked in the same building. I've got this patient with terrible hemorrhoids. None of this preparation H is going to work. I need something more potent.
Yeah.
And you'd make up a rectal rocket or,
Oh, yeah.
or fungal nails. I
Yeah.
didn't want to treat them with
Man.
an oral medicine that could harm their liver and
Yeah.
they'd have to take for 2 months and bankrupt them.
Yeah.
So you would come up with
Yeah.
something very innovative, topical, a lot of pain gels that got people off of opiates.
Yeah.
Back, I guess we went through the opiate crisis together,
Yeah.
and was able to get a lot of people not relying on opiates for their pain
Yeah.
by using creams and gels. But
Yeah.
the bioidentical hormones fascinate me, and that's really what drew me into the world of functional medicine. And it was your expertise, and you did a lot of hand holding.
Oh, yeah.
You still do
thousands
with these
of
women.
Patients. We still have thousands of patients, just like you do. And, you have to be licensed in each state now to ship. So we hold licenses in many states. And, Tom, it's like this. When I'm a postmenopausal woman, just so you know, and I'm like,
I wouldn't have guessed it. I wouldn't have guessed it by looking at you.
Well, it's because I've been on hormone therapy since my middle 40s. Are you kidding me? And it is the cornerstone of anti-aging, ladies and gentlemen, if you're listening. It's a cornerstone of anti-aging are bioidentical hormones. And I'll put it to you this way. It's hard to take advice from a young person that's never had a hot flash. But, boy, if you're like me and you thought you would internally combust because the hot flashes were that bad, you're going to listen to somebody who's gone down that road and found something that would treat the symptoms like I did, and that was bioidentical hormones.
Yeah. And not just the symptoms, but they treat everything else like osteoporosis. There's no better treatment for osteoporosis than bioidentical
It's
hormones.
not your bisphosphonates. I mean, for heaven's sakes, it's honestly natural micronized progesterone that can reverse some of the bone loss that's already occurred.
And there's no doubt that people don't know about it because you don't learn this in medical school or residency. You have to go seek it out. So in other words, there's a lot of even gynecologists who should be doing most of this that don't know anything about it, or they're poo-pooing it because they don't know. Doctors tend to be arrogant at times, and if they don't know something about something, they're going to poo-poo it.
Yeah, totally.
And that's just what happens. So there's a generation of women being denied bioidentical hormones because that their doctors are afraid of it, or they've heard something about it, and really it's they're doing a lot of harm to themselves.
But you know what's going on, Tom? You can't patent a naturally occurring substance like your estrogen, your progesterone. You see that
there's no money in it for pharmaceutical companies.
Prometrium is a brand name drug, okay? Yep. But they couldn't patent the drug. They had to patent the release of the drug out of the capsule they had. And why in God's name they picked peanut oil to put it in, I don't know, with allergies and stuff. But they can't patent a naturally occurring substance, so the drug companies can't make money off of it. Yeah. So they have to patent a different way. That's why when I was in pharmacy school in the 80s, the number one prescribed drug was Premarin. And if you do a little research on Premarin and how it's metabolized into equine horse estrogens, and only one of them's remotely similar to what a woman makes, and it's the one that can cause breast cancer, then they don't want you to know that stuff. They don't even make it in this country. It's made like in Canada because of what they do to the pregnant mares. I won't even go into that. But, I told women, I said, if you go to the restroom and you feel like kicking the door and neighing, then in your own Premarin, then you don't need to be on Premarin, okay? I mean, and what did they teach you? If you don't have a uterus, you don't need progesterone. That's one of the worst things in the world.
Agreed.
And they still hold that stigma. You don't need it. Progesterone I'm going to get the chemical symbol for progesterone and put it behind my desk is what I want to do.
It's very different than medroxyprogesterone.
The feel-good hormone, what's a major complaint when women come into you? Generally, they can't sleep, and they have no sex drive, and they are depressed.
Yep.
Well, what the heck? Progesterone, you said it perfectly. They're not deficient in Prozac.
No.
An antidepressant. They're deficient in progesterone. Why not give them what they're deficient in?
That's exactly right. Plus, what about testosterone? Women need testosterone just like men do.
Yeah,
just a
we
lot
might
lower
need
dose.
a teeny tiny dose where a man may take 50 or 100, but a woman needs maybe 0.5 to 1 or whatever. And topically, bone density, overall well-being, sex drive, all those things that testosterone, you still have to have it. Men have to have progesterone.
Exactly.
You
I
know?
take a little bit of progesterone myself.
I told women who is the primary. You get the women in, then they'll bring the husband. And I told women, I said, if your husband's begin to get man boobs, and if he cries at sad movies, he may need to see Dr. Tom.
That's right. Estrogen and progesterone kind of counterbalance each other. And a lot of these guys, especially if they're overweight, they're aromatizing this
Well, they will
testosterone, what
convert
little
to-
they have,
yeah.
to estradiol.
Well,
So-
yeah, they'll convert to estrogen. That's when you have to put them on an estrogen blocker, and to get their test levels up. But one thing, when we were first learned about hormone therapy, there was a physician, and he said, Eldridge Taylor, I believe, he said, I can take a woman that's 60 and a man that's 60 and check their estrogen levels, and you know who's going to be higher? The man.
Man,
Because
exactly
it
right.
converts, like we said, what is it cause prostate cancer? Elevated estrogen.
Yeah, it's not testosterone. Testosterone
Right.
does not cause prostate cancer or even prostate enlargement, but estrogen can. So
So,
that's something
yeah.
doctors don't know.
No, they don't. They're not teaching you that, are they? They
No.
didn't teach me that. We had to go out and learn this on our own. And man, has it been a blessing to the people we serve, the patients that we have, because they get the inside knowledge of why. And Tom is a good, he's a good teacher. And so, you know what our job is? To equip the patient to go back. And when I couldn't prescribe it and you weren't doing this, and I remember those women coming in begging me, help me, I'm about to die. I can't sleep. I'm having hot flashes. And I would teach them about the hormone therapy and equip them and send them back to their doctor.
Yep. You cured them
And,
when doctors knew nothing about
Oh,
it.
it was funny.
I mean, you
And-
taught me what to do
Yeah.
because you really do need to know what you're doing if you do
Yeah.
hormones, because there's a lot of nuances to it.
Yeah.
You got to know which pathway it's being metabolized through. Most doctors just don't care, or they don't think it's going to be that beneficial to you.
Man,
but
I had more women come to me for thyroid because thyroid's a hormone too, and we put that right in the mix when we do their levels. And, because all this is affected, hypothyroidism or just thyroid in general. I did a lot of infertility work too with Dr. Pickens Gant.
Yep.
And if the thyroid's messed up, or even the amount of body fat, basically, there's so many things that can go awry. But the wonderful thing, I love doing saliva test kits because it would tell us what was going on at the tissue level instead of what was going on in the blood. The blood's a snapshot of what's going on at that particular time of that particular day, but the saliva would give us the baseline tissue level.
that's exactly right. Even
And-
cortisol.
Yeah, cortisol. That's a gold standard, 4-point cortisol in saliva. But I'm telling you, to find out that these women were deficient in progesterone because of the stress, and that goes back to cortisol, and then being able for them to get pregnant when we found out, when just simple things like doing saliva tests, it was amazing. And I bet you see, I know I talked to a lot of women in their 30s and mid-30s, and infertility is huge. And the older, but it's what we eat and breathe and drink, and there's
It
a lot
is.
to it. But it is the progesterone too.
Yeah, it
Due to
is.
stress.
Robin Riddle, who works with me in my Knoxville clinic, is an expert on fertility.
Yeah,
and she
okay,
helps
there you
people
go.
with
Isn't that great? I love it.
But the sad fact is, the FDA does not like compounding pharmacies, and there's going to be a crackdown. There already is a crackdown on some of the stuff like semaglutide, and I'm gonna have to get Bobby on here talking about that one.
Yeah.
About because people can't afford Ozempic or Mounjaro for weight loss, really, unless they're a diabetic. And still, there's such a shortage of that you can get semaglutide, in a compounding pharmacy, but they're trying to crack down on them a little
Well,
bit.
it's because even if something comes off patent, you should be able to get the powder to make that, or the chemical. But what has happened is the FDA now has come in and said, well, we think that's demonstratively difficult for you to make. Now, who determines that it's too hard for us to make? We've been making it forever, sterile and non-sterile. Well, now they passed legislation when all the thing happened with New England Compounding Pharmacy, and it was called DQSA. They will not give us a definition on dispense and distribute. And I've said this forever when I've been going up to see my congressmen, my senators. I'm like, we can't get definition. They still won't give us a definition. The FDA is putting barriers up to compounders and physicians wanting compounding medications for their patients because they're like, well, it's an inordinate amount. I'm like, well, what the heck is an inordinate amount? They can't give you a number. So it's left up to interpretation when they walked in, or it's too difficult to compound, or now they have something called a memorandum of understanding of how much compounding you can do and ship across state lines. I'm 5 minutes from Virginia, for heaven's sakes. I'm telling you, if you're a border state, there should be different rules. But FDA, they listen to Big Pharma because I want you to know this. It's a revolving door. You have the head of the FDA. When he's finished with the FDA, he goes and sits on the board of one of the pharmaceutical companies. When they're finished, they come back to the FDA.
Time after time.
It is absolutely that way. And I'm ready to bust that up. And there's got to be, Congress has given away their authority to govern.
Yeah.
And we've given it away to bureaucratic agencies with 3 and 4 letters, and that's not, I'm up there to change the way business is done. And you can't fix it if you don't understand it. So that's the beauty of it.
That's exactly
Tom.
right. And you can't understand medicine unless you actually practice it.
Totally.
As a pharmacist or a doctor,
Yes.
you cannot understand it
No.
if you're in a lab somewhere, or if you're around a bunch of guys in ties and suits or just trying to call the shots, but not talking to the patients.
Yeah, no, and it's a travesty. We do so many good things, and we're problem solvers, and that's what I went to Congress to do, is to be a problem solver. And I tell them, you can't operate this way. You need to do it this way. And well, we'll take that under consideration. I said, well, I better see some changes. You know, that's the beauty. You know, why did I raise my hand and say pick me? Because in order to create change, you have to be the change that forces them. And you have to force anything in Congress. You have to force change. I'm just telling you. It's business as usual. And that's why the bureaucratic agencies with people on that were never elected, that's key, never elected, are the ones setting the rules for you and me to practice under.
Yep.
And that's not acceptable. And I think they know my name by now.
I think they do too. I've seen it up there. I've visited you up there.
Yeah, I got you a tour, Tom.
But what better person to be up in Congress, especially with the healthcare system, than a compounding pharmacist?
Yeah.
I mean, to be a compounding pharmacist, you have to be way more educated than typical, and you have to kind of think outside the box. And so now you've been going up there for years, and now you're actually up there as an agent of change, and you can actually do this. So we're kind of excited about that.
Well, that's why, you know, when you sit back for years and you let the people that you tell this is what you need to do, and it doesn't get done, it's like, well, heck, I'll just do it myself. And that's why, and we need good people to run. If you are in a profession you want change, you know, I'll help you in any way I can, but man, we need good people who have lived a real life and worked a real job to raise their hand and say, pick me. And it does matter. It matters who governs at every level, whether it's local, state, at federal, and you know, at every level. I'm talking from school board to the White House. It matters who governs, because if you have lived a real life, if you can work a job, run a business, and raise family all at the same time, and teach Sunday school like I did for 24 years, you are a well-rounded person. And after you teach middle school for 24 years in church, hey, Congress is nothing, nothing. Okay, that's what I tell them. I'm still teaching middle schoolers.
Thank God for our teachers.
Yes, exactly.
The most honorable profession there is, I think,
man.
the most influential at least. But, you know, I really thank God that we have you in Congress and are up there doing good. You're a normal person who's going up there. You're driving your truck up there every week and back, and you're making a change. And so keep it up. We're proud of you. Keep going for
so
us.
sweet,
and
Tom.
we really want you to help our healthcare system, because really it's really in a flux right now. And I think we can come out ahead if we change a few things.
Tom, there's so much we're doing on the Health Subcommittee of Energy and Commerce. I want your viewers to know if there's specific questions they have. We may already have legislation in the works to do that. We're constantly, you can always go to C-SPAN and look at hearings, or the committees and look at different hearings, review those, listen to the questions. You can always contact my office, but what my friend Dr. Rogers is saying, he's one of the cream of the crop doctors. That's what I want you to understand. This man has worked in corporate medicine, and now he's doing his own thing, and he's more successful than I know you ever thought you would be. And people love him because he takes the time to ask the questions, to figure out what the problem is, and then to treat. That is what we took that oath for. And I'm trying to do that. I'm diagnosing Congress. Every day I'm on a committee, I'm trying to diagnose the problem so I can come up with a solution. It may be 2 or 3 options, but you know what? That's why we need good people with common sense.
I agree.
Making laws and legislation. So
agree.
we can practice the way it was meant to be.
That's what I do now, or I wouldn't be practicing medicine. I just cut all the red tape, all the middlemen out. It's just me and the patient.
Yeah.
That's the most important relationship in medicine to me, is doctor-patient. And along with the pharmacist too, because
that's your
we've got medicines that we need, especially these unique compounds that we use for baby boomers like us.
Well, my husband's a pharmacist, but he's a chemist. My son's a pharmacist, he's a chemist. And my daughter-in-law works at the VA as a pharmacist. Here I am taking what I know about pharmacy and taking it to Congress. That goes back to, if you know the chemistry behind these medications that you need, we can formulate anything. Yep. And it's hard to find a good compounding pharmacist who is also a chemist. And we've got that right here in Kingsport, Tennessee. And so if there are issues, Tom, you're the man. He'll diagnose
Plus,
you.
you can ship all over the country as well. Premier Pharmacy is, to me,
and it is Premier.
Pharmacy.
I should have told you that before. Premier Pharmacy.
Yeah. It's amazing. I've worked with them for years and years. And like I said, they started me in this aspect of my practice, and I love my practice. I mean, I don't think many doctors would tell you that right now.
You want to get up. You want to enjoy it so much it's not a job. They
exactly
call you doc,
right.
and you know what they're talking about.
And all these older doctors like me have already retired or retiring because they're so burned out
anymore.
with all the red tape and the bureaucracy. They'd rather retire. And to me, there's nothing in medicine as beneficial as experience. Do you think?
Man, that's what I'm saying. Institutional knowledge, and we're losing those good doctors because they're just swimming to the other side and saying, "I'll see you later. Wish you well." But when they leave the scene, it leaves a void, because I talk about old drugs sometimes to even my son or the other pharmacists or people, that I'm out with. They're like, "What is that? Never heard of that." I'm like, "It's good. Go check it out. Look it up. Google it. Google it. That's your generation."
Repurposed drugs. I mean, what is it? 80% of drugs are used off-label.
For God's sakes, that's another thing the FDA has screwed up, okay?
Yep.
Don't penalize these physicians for using drugs off-label. I'm working with a geneticist out of Florida, and there's some work that he's done, but we really need to get more aggressive with this, that you can take 7,500 drugs. There's a database, and you can reevaluate and repurpose those drugs based on their mode of action. This geneticist is wanting to do that. And even when COVID hit, they had already done that with 10 drugs that would have worked for COVID. But do you think the government looked at that?
No.
No. And we know which ones they are, and then which ones they threatened us. And the AMA is another agency that is not doing what it should do, and a lot of physicians have pulled their membership to that organization.
I've never belonged to that organization.
No, they absolutely will tell you what you can and cannot do, and I'm not about that.
Yep,
Not about that at all. Listen, we live in America, the land of the free, and that's the way we want to keep it, and we want patients to have a choice, and I just got to teach the government that, okay?
I hope you do, and you are. And thank you so much for coming on this podcast. We'll do this many more times if you can. If you can get
pick a topic, any topic. I probably know something about it now that you got to know everything up there. If I don't, I'll go out and get somebody who does know.
Well, you do know what you're talking about. And I thank you so much for all you do, and thank you for this podcast. Yeah. Thank you from all the women that you've pulled through menopause and longer, because it's really not just about the hot flashes. It's about your brain, your bones, your heart, everything.
Yeah.
So
all they gotta do
you
is
have a special place in their heart for that. I've seen you counsel them for hours.
Hours, man.
I don't see how you have the energy or the time to do what you do. You're a phenomenal person.
That's why you do preventative medicine, Tom, so you can keep going. Really, I tell people I'm 92 and I'm still going, but that's not true. I'm just joking. But that's an icebreaker, I can tell you that, when I talk about anti-aging functional medicine. Just tell them you're 92. They'll listen.
Well, Diana, thank you so much. I hope to get you back on the program. And
I'll be happy to.
good. Be safe on your trip back to Washington this week. And
I will.
thank you for all you do.
All right, Tom, it's a pleasure, my friend, and anytime. Please contact this man. He's great. If you have questions for me, Tom will get them to me, or you can contact my office.
You really can get a hold of her, believe it or
Yeah.
not.
I'm
She's very
accessible.
approachable. Thank you. We'll see you next week.